Hello, this is Dr. Evan Osar with Chicago Integrative Movement Specialist. Welcome to this newsletter, where we're going to discuss massage as medicine. We know the benefits of massage. We know that massage feels good. We know that it's great to get a massage. Unfortunately, too many times we leave massages for special occasions like a birthday, or while we're on vacation, or when somebody gives us a gift certificate. But what I want to discuss is how massage is so much more important than just a feel-good experience, and why massage is so essential to your overall health. So let's get started. So what exactly is massage? Well, technically it's to handle, touch, or to work with the hands. And through the work of the hands on soft tissue structures such as the skin, the muscle, the fascia, that connective tissue that connects the skin to the muscle, connects muscles together, connects the organs to each other, connects every single cell in our body, and the ligaments, we can affect various structures in the body. We can affect joint motion. We can affect blood flow. We can affect lymph flow. And we can even have an effect on the overall stress hormones and overall hormones in our entire system. We'll talk about that a little bit more in a couple slides. What are the benefits of massage? Well, we know that massage can definitely help reduce pain. We know it can help improve performance. Athletes use massage both as a way to manage their conditions from training. We know they use massage to help benefit them after they've competed. And we know that massage can have a very important effect on posture, which we'll also show an example of in a little while. So what does the research say about the benefits of massage? Well, research demonstrates that people with low back pain and osteoarthritis, or that degenerative joint condition as we get older and from overuse, can benefit from regular massage. Massage has also been shown to decrease blood pressure, decrease inflammation, which is a huge contributor to osteoarthritis and painful conditions within the body, and decrease stress, which is another driving factor for a lot of dysfunction in the body. And another important aspect of massage is it can boost our immune system, and that's mostly through blood flow, through the hormone regulation, and overall decreasing the nervous system excessive activity that we get from too much stress, too much caffeinated products, and just overstimulation in our given day. So there's a lot of great overall effects of massage beyond just feeling better. Massage comes in many different forms. We have Swedish, which is a general massage technique, a common massage technique that's a little bit lighter, deep tissue, where the therapist will get in a little deeper and get to deeper layers of structures. We have sports massage that's more specific to certain areas and or activities that may be related to sports. We have acupressure, which is using specific points on the body to create different types of responses. Shiatsu, which is a general overall body movement and specific type of massage. And myofascial, which comes in many different forms of massage type techniques as well. So how do you know which type of massage is best for you? Well, it depends. It depends on what your specific goals are and what your specific needs are. If you're an athlete, for example, you may want a deeper tissue massage to release trigger points, to release tight structures, to release tight fascia. Whereas if you have low back pain, you have to choose a different type of massage. You don't want to get in there and release, or have your manual therapist release all the trigger points and all the tightness. Because remember from our last webinar on yoga, why do we get tight? We get tight because we're trying to create stability. So tightness is a response to instability. And if we simply just go in and release all the tightness and restrictions, well, now we're vulnerable to increased injuries. And that's why clients come into our office many times and say, I had low back pain, so I went to get a massage, and I felt worse afterwards because the massage therapist didn't recognize that the tightness is your body's response to instability. So it's trying to create a more stable environment. And then the massage therapist, by releasing the soft tissue structures, actually made them more vulnerable. So we want to be careful about the different types of massage we use when we're actually in pain. What about following an injury? So post-injury is a great time to get a massage as long as it's specific. So we want to make sure it's specific to the area that we're working, specific to the tissues that are being manipulated. For example, if you have an ankle sprain, you want to work around the ankle, not directly over the ankle until it's relatively healed. Then massage right over top the injury can restore blood flow, can improve and restore tissue mobility. It can restore joint positioning. Following surgery, you don't want to get over the scar tissue right away. You want to allow the scar tissues to set up, but then many years or many months to years after surgery, so if you've had a C-section or low back surgery or a knee surgery, there's lots of layering of scar tissue underneath the scar. So a specific type of massage, like a myofascial release or a lighter technique or scar tissue mobilization, may be more appropriate for that type of injury. So again, it depends on the condition and that you choose the right massage for the situation at hand. So say, for example, your goal was to improve your posture. So many of our clients come in and complain about neck tightness, shoulder tightness, low back tightness, hip tightness, because again, most of us sit at our desk for a living or we sit for a living. So we get these postural alterations because of poor stabilization, prior injuries, surgeries, traumas that put stress on our body, and then we sit for a living, and that just adds to and compounds the postural issues that we tend to have. So with this gentleman, for example, we want to release specific structures. We don't want to just generally massage his entire body and release everything that's tight, because remember, we can have short, tight muscles that are pulling us into this poor posture, like the forward head, forward shoulders. But we can also have over-lengthened muscles. So like the blue arrows are indicating areas where he's actually over-lengthened through the abdominal wall, through the upper back erectors. These areas are over-lengthened. So we want to do a more specific shortening type massage technique on these regions. We will feel tight in all the regions where the arrows are pointing, but we have to use a different type and different strategy on the soft tissue structures around those areas to create improved posture and also improve stability. So how do we do this at Chicago Integrated Movement Specialists? Well, once we release, then we have to reactivate. Then we have to turn some muscles on that have been turned off, or the ones that are over-lengthened we have to shorten. So we have specific massage techniques that we use to help shorten those muscles. And then we have to teach repatterning. So whatever you've done to the body, you have to teach the nervous system how to control the new position that you've been put in. So whether it's postural retraining, whether it's stabilization work, whether it's specific exercises, whether it's how you breathe, whether it's a combination of all these things, which generally it will be, we have to repattern the body so it knows how to use the new position that you were just put in by the soft tissue release. So what is the integrated movement approach to massage? Well, as we said, we have to first release the short, stiff structures, increase tissue mobility so we can have proper motion and the proper ability to get into the right positions. Then we have to reactivate the proper and appropriate structures to create a more stable structure because we've just released something. And then we have to teach the client, an individual, how to repattern their body so they have improved posture, improved movement, and improved habitual patterns. The things that generally break us down are how we chronically move, so we have to teach a client how to move in a new and improved fashion so they do not go back into their old patterns. I hope you enjoyed this webinar. This is Dr. Evan Osar with Chicago Integrated Movement Specialists. And if you have any specific questions about massage, whether massage is right for you or the type of massage you're currently receiving, feel free to contact us through our website and/or at 773-343-4012, and we're happy to answer any questions. We offer different types of massage at our office that's specific to your goals and your needs. We have lighter techniques that help to decrease scar tissue, so post-surgical, post-injury, and that help to quiet down the nervous system so we can put in good information as far as posture and exercise. And we have deeper tissue type techniques and myofascial release strategies that are more specific to clients that need specific work and adjustments through soft tissue structures. And it works in combination with what I do as a chiropractic physician, and it works in combination with what we do with our movement retraining. So I hope that you enjoyed this webinar. Have a great day. We'll catch you next time. This is Dr. Evan Osar with Chicago Integrative Movement Specialists.